first identify yourself for the record, your name and your employer.
Randy Zook, President and CEO of Arkansas State Chamber of Commerce.
Tom Brower, Senior Vice President of Occupational Safety and Health, Tyson Foods.
If you'll raise your right hand. Do you solemnly swear or affirm that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
You may be seated. Mr. Zook, Mr. Brower, Randy, we have you on the list first, but just start where you would like as far as what you'd like to say about the employer-mandated vaccinations and why they need to be done and where the chamber is at on this.
Very good. Thank you very much. And thank you, Senator. Thank you, Representative and Chairman Lowry. Appreciate this opportunity to discuss with you a very challenging, very difficult issue for all of us. There's a lot of irony in this conversation today. I refer to this morning's headline that we now have 10.1 million jobs open and begging for employment for people across the country. If you do the math on Arkansas's share of just about everything economic, that would mean that we have something crowding 80 to 90,000 open, unfillable jobs in the state at this point. Again, the most in our history. Many businesses, I've been searching my memory over the last 30, 45, 60 days trying to remember one business that is not struggling to find enough hireable people. It is an unprecedented challenge. We are paying record wages. Wages are increasing on nearly a daily, but certainly a weekly and monthly basis. So these are all good things. This is what we've prayed for, hoped for coming out of the pandemic. After the Trump vaccine gave us a life raft and a rescue method to survive this crazy thing, then we've all been hoping for this kind of growth, and here it is. As a result, or along with that, many supply chains are faltering all over the world. Goods coming from every corner to the U.S. and our goods getting to every corner of the globe. So all these things are problems that have been driven by the COVID vaccine, which has been disruptive to business and to the economies of the world, to put it very mildly. Nearly every employer that I have talked to is doing all they can to be safe in this environment. Safe for their customers and safe for all their employees, suppliers, and interested or related parties. Despite all those efforts, we have strained relationships all across the economy, all across, all across the state. We heard sad tales in this room yesterday about nurses and the struggles they're dealing with, about healthcare employees from the loading dock of a hospital to the intensive care or surgery suites. Everybody in that sector of the economy is facing unprecedented challenges, difficulties that many are finding it just too much to bear and are walking away from good and vital employment relationships. All that's true, all that pulls at our heartstrings, all that is incredibly emotional, but at the same time, at some point, a time comes when hard decisions are necessary. When all you can do is all you can do, including requiring vaccination for employees. And this is the employer's right. Arkansas is an employment at will, right to work state, and we urge you, we beg you not to jeopardize that or to compromise it in any way, because it would be an astonishing setback to the economic prospects and growth of our state. The proposals that are under consideration not only prohibit private businesses from requiring their employees to get vaccinated against the deadly COVID-19 virus, but they also prohibit private businesses from even inquiring into the vaccination status of employees. This bill goes against all of the advice of every trusted medical expert of both the state and the federal government. And most importantly, this bill, as I said, is in direct contravention to our state's proud history as an employment at will state. It prohibits private employers from taking the most basic and universally suggested precautions to guard the safety and health of all their employees and the families of those employees. And in doing so, it also prohibits businesses from protecting their valued customers and clients, opening up potential negligence claims by those customers. And finally, it would require private businesses to violate the guidance of the CDC and thus to be in violation of certain OSHA standards. This is a box that we are painting people in if we pursue this path. This would subject those businesses to substantial fines and other penalties. Let me hit just a couple of points on each of the two bills that were under consideration or being proposed. The inability to mandate vaccines or require a vaccine status carries significant legal risk for employers, including, but not limited to, the following. Number one, COVID-19 guidance from the CDC and the Arkansas Department of Health suggests employers take different precautions based on the vaccination status of their employees. For example, CDC guidance suggests that fully vaccinated individuals need not take as many precautions as unvaccinated individuals due to the heightened risk of severe disease and poor health outcomes from COVID-19 for non-vaccinated individuals. If employers then are unable to ascertain the vaccination status of their employees, then they're unable to adequately assess the potential risk to employees, vendors, vendors, and customers. They're also, therefore, unable to adequately address the potential risk of complying with CDC and Arkansas Department of Public Health guidance. The second point, the inability to follow CDC and Arkansas Department of Health guidance also puts employers at risk for negligence actions by employees and customers who could claim they contracted COVID-19 as a result of the employer's failure to take proper actions to limit the spread of the virus. Act 559, passed by this legislature on April 5, 2021, codified an earlier executive order that provided a shield from tort liability for businesses for COVID-19 related claims. Under Act 559, a business enjoys the presumption that it is not committing willful, reckless, or intentional misconduct and therefore enjoys tort immunity if it is, quote, substantially complying with health and safety directives or guidelines issued by the governor, the Secretary of the Department of Health, the Centers for Disease Control and Prevention, and the Centers for Medicare and Medicaid Services concerning COVID-19. That inability to ascertain vaccination status prevents employers from complying with COVID-19 guidance and therefore exposes them to tort liability for COVID-19 claims. The proposed legislation would essentially moot the protections available under Act 559. Third point, stripping employers of the ability to either mandate vaccines or to inquire about vaccination status strips them of their statutory right to deny accommodations on the basis of a direct threat. It also renders them unable to make a complete assessment of potential direct threats. Fourth point on that particular bill. That proposed legislation would strip employers of the ability to determine whether requiring a COVID-19 vaccination is job-related and consistent with business necessity. Courts have already upheld the right of employers to mandate COVID-19 vaccines and to terminate employees who fail to comply with the vaccination requirement. Most notably, Houston Methodist Hospital recently terminated almost 200 employees who refused to comply with the hospital's COVID-19 vaccine requirement. A federal judge in the Southern District of Texas found that, quote, every employment includes limits on the worker's behavior in exchange for his remuneration. That is all part of the bargain. Now on the other bill, the second bill that would require or even incentivize or prohibit a bonus program for vaccination. Point one, vaccine manufacturers are immune from liability for unavoidable adverse side effects of vaccines under federal law. I don't know how to quote the site, but I can get it for you if you'd like it. Thus, the proposed legislation creates a scenario where the manufacturer of the vaccine causing alleged side effects could not be held liable for side effects, but an Arkansas employer that offered a bonus to its employee to get the COVID-19 vaccine could be held liable. Number two, the bill does not contain any statute of limitation. And number three, the bill does not define what a bonus structure program is. Thus, employers may unknowingly create liability for themselves by offering minimal or non-cash incentives for employees to get vaccinated. And with that, I would just simply offer myself for any questions. But to sum up, I think there's plenty of legal evidence, there's plenty of legal support for allowing, as we do today, employers to exercise their right to expect and set and expect compliance with the terms of employment, including mandatory vaccination for COVID-19. We urge you to not let this cat get out of the bag. So, happy to take any questions.
Thank you, Mr. Zook. Before we've got several in the queue for questions. Before we go to questions, I'd like to go ahead and hear from Mr. Brower. Mr. Brower, thank you for being here. I would like to have seen a number of other employers being here, but we certainly appreciate you coming to testify today.
Thank you, Senator. And I appreciate you giving me the opportunity to speak. My name is Tom Brower. I work for Tyson Foods. I have dedicated my career to protecting human life in the industrial environment. At Tyson Foods, the health and safety of our team members is our top priority. Since the start of the pandemic, we've taken steps to protect our people. We have spent hundreds of millions of dollars transforming our facilities in response to this threat. Our efforts have included walk-through temperature scanners, workstation dividers, social distancing monitors. We've established mobile health clinics. To stay ahead of the virus, we implemented a COVID-19 monitoring program that involves randomly testing thousands of team members every week. We've also been strongly encouraging our team members to get vaccinated. Since February, we've held more than 100 on-site vaccination events for our team members. We believe that getting vaccinated is the single most effective thing you can do to protect yourself, your family, and the communities where we operate. While we've made progress, about half of our U.S. workforce remains unvaccinated. Last week, we announced our intention to require the rest of our team members to be vaccinated by November 1st. It wasn't an easy decision, but since last week's announcement, approximately 5,400 of our team members have been fully vaccinated or received their first dose. While we will continue to make the vaccine accessible through on-site vaccination events to ensure that team members are connected to local vaccine providers, we strive to provide convenient access for all team members. We also continue our efforts to answer team member questions about the vaccine and address any concerns that they have. Given concerns about the spread of the new Delta variant, we believe requiring vaccination is the right thing to do, and we believe that this decision to require vaccination is essential to protect our workers. Thank you, and I'll be happy to take your questions as well.